Pneumonia is inflammation of the parenchyma of the lung. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, purulent material. Etiology: bacterial, atypical, protozoal, fungal, allergic, radiation collagenosis, chemical, gases, smoke, kerosene, petroleum. Predisposing factor: after host defense. 1. Exposure to cold facilities, the passage of mucus containing pneumococci from the upper respiratory tract to the lower. 2. Postoperative, especially after abdominal operation, because anesthetic agents suppress respiratory defense. 3. Smoking, chronic bronchitis, alcohol. 4. Infection of the upper respiratory tract, sinus, and bronchi. 5. Poor nutrition and illness. 6. Immunological deficiency. 7. Uncontrolled diabetes. 8. Corticosteroid therapy. 9. Chemotherapy. Organisms in specific situations. 1. Young, previously healthy individual, pneumococci, mycoplasma, Legionella. 2. Elderly with chronic lung disease, pneumococci, H. influenza, chlamydia. 3. Hospitalized patients, Pseudomonas proteus, Klebsiella, E. coli, Staphylococcus. Site of pneumonia. 1. Right lung is commonly involved because it is in continuity with the trachea. 2. Recumbent patient. Posterior segment of upper lobe and superior segment of lower lobe are involved. 3. In sitting up position, basal segment of lower lobe are involved. 4. Apical, tuberculosis or Klebsiella. Pathology. 1. The initial phase is one of edema with the presence of a proteinaceous exudate. 2. Phase of red hepatization consists of the presence of erythrocytes in the cellular intra-alveolar exudate. 3. Phase of gray hepatization, due to lysed and degraded erythrocytes, corresponds with successful containment of the infection and improvement in gas exchange. 4. Phase of resolution. In the final phase, the macrophage reappears as the dominant cell type with clearance of the inflammatory response. The symptoms of pneumonia can range from mild to severe and include fever, chills, cough, usually with phlegm, a type of thick mucus made in your lungs, shortness of breath, chest pain when you breathe or cough, nausea and/or vomiting. Diarrhea. The symptoms can vary for different groups. Newborns and infants may not show any signs of the infection. Others may vomit and have a fever and cough. They might seem sick, with no energy, or be restless. Older adults and people who have serious illnesses or weak immune systems may have fewer and milder symptoms. They may even have a lower than normal temperature. Older adults who have pneumonia sometimes may feel weak or suddenly get confused. How is pneumonia diagnosed? Chest X-ray, complete blood count sputum test, chest CT scan, blood culture. Treatment. General measures. Position should be most comfortable. Initially light diet. With improvement, the patient may gradually return to full diet. Copious fluid intake is advised as patient loses fluid from sweating and overbreathing. Antibiotics. Ampicillin or tetracycline 0.5 gram 8 hourly orally, or ciprofloxacin 500 mg 8 hourly orally, or cefotaxime 1 gram IV 6 hourly, or doxycycline 100 mg twice a day orally for 3 weeks. Symptomatic medication for pain and cough. Always consult your doctor before taking any medicine. Complication of pneumonia, pleural effusion and empyema, lung abscess, jaundice, pneumothorax, peritonitis, herpes labialis, meningitis, pericarditis, endocarditis. Prognosis. The following factors make the prognosis poor. Very young or very old people, very high or very low. WBC count, jaundice, staphylococcal, Klebsiella or type 3, pneumococcal, pneumonia infection, positive blood culture.